Hi, I'm Npmcn and I'm here to talk about gangliosidosis. So what is gangliosidosis? It is an inherited lysosomal storage disorder that progressively destroys nerve cells. It destroys nerve cells in the brain and in the spinal cord. This condition may be classified into three major types based on the general age that signs and symptoms first appear. We first have the type 1, which is a classic infantile. We also have type 2, which is the juvenile. And the third and last one is the adult onset. Although the types differ in severity, their features may overlap significantly. GM1 gangliosidosis is caused by mutations in the GLB1 gene and is inherited in an autosomal recessive manner. Now let us dive deeper into the three general types of GM1 gangliosidosis. Starting off with the most severe type, with onset shortly after birth, this is the type 1 classic infantile. Affected infants typically appear normal until onset. Signs and symptoms may include neurodegeneration, seizures, liver and spleen enlargement, coarsening of facial features, joint and muscle weakness, and problems with gait. About half of the people who has this type develop cherry red spots in the eye. They may become deaf and blind by 1 year of age. Unfortunately, affected children typically do not live past 2 years of age. Now let's proceed to the more intermediate form of this condition, which is the type 2 juvenile. It may begin between the ages of 1 and 5. Its symptoms and its features include the following: ataxia, seizures, dementia, and difficulties with speech. This may progress more slowly than type 1, but still causes decreased life expectancy around mid-childhood or early adulthood. Now let's move on to the third and final type, which is the adult onset. This may develop anywhere between the ages of 3 and 30. Affected people may have muscle atrophy, corneal clouding, skin blemishes may also develop in the body, and lastly, dystonia. Adult GM1 is usually less severe and progresses more slowly than other forms of the condition. Now, to fully understand this disorder, let's take a look at the life of Eli, a kid that has GM1 type 2.
Hi, I'm Marilee, and this is Eli. I want to tell you a little bit about him. He is my second child. Eli is a very social guy. He likes to be rocked and play with his mommy and his daddy, and his brother and his sister, huh?
Eli, you look so pretty. Did Leia put that skirt on you?
He does not like to be left alone to entertain himself, though. That's not very fun for him. He used to sing at the top of his lungs really high. You go, ah!
Good! Sing more! Good.
When Eli was younger, Eli used to dance like crazy.
Dance.
He still likes to dance. He's a really good dancer, huh, Eli? He loves his trampoline. We got it for him for his birthday when he was 5 years old, and can't really jump on it anymore, but he used to love to jump on it. His favorite toy when he was younger was this baby doll stroller, and he would push it around for hours. He loved to push his stroller around, and as he started losing his ability to walk, I think he liked to push it because it kept him nice and stable. He could still be up and walking. Eli is a hard worker. Huh, buddy? You're such a hard worker. When he would fall, he would just get right back up and keep trying. Whoa, 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 whoa. You okay? You just get right back up, don't you? Eli, we're so lucky to have you. Huh, buddy? Are you 4? Yeah. I'm your hey mama, hey mama. Yep, I'm your mama.
Now that we have an idea on what life is like to have GM1, let's discuss the heritability of this condition, or how it is passed on biologically from parent to offspring. As we've mentioned earlier, GM1 gangliosidosis is a hereditary condition that is inherited in an autosomal recessive manner. This means that to be affected, a person must have a mutation in both copies of the responsible gene in each cell. So there is likely a 25% chance to be affected when both parents have the autosomal recessive gene. Statistics says that 1 in 4 children may acquire this disorder. Remember that GM1 gangliosidosis is type-specific within families. This means that people with a family history of the condition are generally only at increased risk for the specific type of GM1 gangliosidosis in the family. There is currently no effective medical treatment for GM1 gangliosidosis. Symptomatic treatment for some of the neurologic signs and symptoms is available, like anticonvulsants, which may initially control seizures, but it does not significantly alter the progression of the condition. There are also supportive treatments that include proper nutrition and hydration, and keeping the affected individual's airway open. There have been reports about a bone marrow transplantation that has been successful in an individual with infantile GM1 gangliosidosis. However, there were no long-term benefits reported. Although we are still left with no effective treatment, the fight to end this condition is not yet over. In fact, stem cell transplantation has been advocated by some as a possible treatment due to its success in other lysosomal storage disorders. There are also active researches in the areas of enzyme replacement and gene therapy for this condition. The study for this is still ongoing, but has not yet advanced to human trials. There is still hope for this disorder to be defeated, but I guess only time will tell. For now, let us actively involve ourselves in advocacies that seek to end GM1. Again, I am Npmcn, and thanks for watching.